Hello, a very good morning to all of you. Today we are going to discuss the case note of Dallas Walters, and this is a patient who has renal difficulties. And you are a charge nurse of the renal ward. He was there, and his age is 51. Now let's see what task we have. The task we have is here, you can see. Using the information provided in the case notes, write a letter of referral. So you have to write a referral letter to the renal clinical nurse specialist. It's clinical nurse specialist, renal department. So renal clinical nurse specialist at Burnbury Community Health Center. So you are writing to a nurse, and the designation of the nurse is clinical nurse specialist, renal clinical nurse specialist. And the hospital, the setup is Burnbury Community Health Center. For what? For ongoing community care of the patient, for ongoing care. So what care you have been giving? So this should be carried out further. So this is what we can see. So we don't have any complex things. We just need to see that this is a referral letter, and we are writing to a clinical nurse specialist, and we are writing to a community health center, and we are writing for ongoing community care of the patient. So let us go ahead with the case note once again. Now, when you go ahead and we can see Dallas Waters is a patient at renal ward, and he was admitted on 16 June 2011 at Charles Gardner Hospital, the hospital that you are working. And he is from Aboriginal background. This is something very significant here because he's not from the native Australian. He's a native Australian that's Aboriginal. He's not an English speaker, so he's from Aboriginal background. So the discharge date is 22nd. So whenever you see Aboriginal background, see it's a native Australian tribe. So you have to understand that there will be difficulty in language, or there will be difficulty in communication between the English speaking people and Aboriginal people. And let's go ahead with the discharge date. That's 22 June. And now what's the diagnosis? The diagnosis is insertion of CAPD catheter for chronic renal failure. So that is the diagnosis here. Now, some other things are important here. That's the mental status before the psychosocial state. That's he's a schizophrenic, and he is getting DSP, that's disability support pension. He's getting, this is something very significant. He's not mentally active. He's mentally not normal. He's mentally not stable. He's relatively stable. It's not actually stable. Right now, he is not having any serious problems, but he is basically a schizophrenic, and he has mild chronic delusions. And right now, he has a supportive wife. We just go with the important things. You are a charge nurse, age, Aboriginal background, Charles Gardner Hospital, admission date, discharge date, diagnosis, schizophrenia, and delusions you have. Now we have his carer as a wife. And now this is another thing, is that his wife has a mild intellectual disability. Now, he has a history of CRF for 4 years, type 2 diabetes. Now, this is not important, like cataract, is not important. Drinking and smoking is not important because he has quit these things. Now we move further. We can see okay, that the procedure was uneventful. Now the catheter insertion, the diagnosis was catheter insertion. Yes. So the procedure was uneventful and catheter inserted successfully. So what happened actually? So successful catheter insertion is done, but the stay was prolonged just because the patient and wife were slow to learn the management of continuous ambulatory peritoneal dialysis. Now, he was hyperkalemic. That's another thing. Let's go with the next slide. So hyperkalemic, and his potassium level was a little bit high. Now, this is what the discharge plan is. So that's CAPD or CRF education. We need to stress the importance, what this is, stress the importance of CRF education or CAPD education for patient, both patient and wife. Patient is not mentally that much stable. Wife is not intellectually good. In that case, you need to enforce. So you need to make the couple understand better what exactly is the condition, what exactly is the procedure which is carried out, all these things, and what exactly is the care which we have to give. And we need to educate them regarding any signs of infection or any signs of peritonitis, and the importance of the diet with low potassium. And if you have any psychosis signs, you have to inform to the doctor. And if necessary, you have to get the Aboriginal health worker to reinforce. If the patient is not understanding what exactly his condition is, what exactly his treatment is, you need to get this service of an Aboriginal health worker to reinforce what exactly the thing is. So we have got these things here, and we are writing to a letter of referral to this renal clinical specialist here. Now we have written that date, renal clinic nurse specialist, all these things are here. Dear sir or madam, reference of the waters, it's okay. I'm writing to refer Mr. Dallas Waters. So this is a referral letter. So we have written the word refer. The purpose is clear. So it's a referral letter. So we are writing to refer Mr. Dallas Waters, who requires what he requires for the care and education regarding his renal status. We have a lot of things here. We need to educate him and his wife regarding the importance of the diet, the importance of the signs of infection, peritonitis, catheter infection via catheter. So we have a lot of things to make them aware of. So we have to say in common, we have said regarding his renal status, you understand his renal status is not satisfactory. So he has had renal problems since for the past 4 years. So thing is that he has to get his education update regarding his renal status. So he has been initiated with continuous ambulatory peritoneal dialysis. Don't write a short form in the purpose. Don't go with the abbreviations in the purpose. So go with continuous ambulatory peritoneal dialysis as a whole. It's an expansion for CAPD. In the purpose, please don't write the abbreviations. It's not so recommended. So has been initiated with because we have inserted the catheter for CAPD. We have written he has been initiated with a continuous. Initiated means started with the procedure or continuous ambulatory peritoneal dialysis and is being discharged today. This is 22nd. The date is today he is getting discharged. Okay. On 16 June, that's today's 22nd. So I don't need to write a year here on 16 June because we have written 22nd June 2011. So the year is already mentioned here. Already, if you scroll up, you can see the year mentioned here, 2011. So it's understood on 20 June means 2011. It's understood on 16 June, Mr. Waters was admitted to our care with worsening symptoms of renal failure. So he has a history of renal failure for the past 4 years. If you want to mention that, you can mention that the history that he has had renal failure for the past 4 years. If you want, you can. If you don't have the space, you just leave it. We have said what's happened, worsening symptoms of renal failure. It is understood that he is having renal failure and this is worsening. It's understood by the reader when he or she reads. It's understood that what happened. So if you want, if you have enough space, you can go with that he has had renal failure for the past 4 years, for which he's underwent a successful catheter insertion for CAPD. Here I have given the short form, the abbreviation, because you are writing to a medical professional. You can definitely write an abbreviation, but before that you have to give the expansion. We have given the expansion in the purpose paragraph, continuous ambulatory peritoneal dialysis. So every time further, you don't need to go ahead with the expansion. You can just consolidate it with abbreviation. So during hospitalization, Mr. Walters experienced a slight increase in his potassium level, which is currently normal. Now it's normal, but we have to inform that there was a problem. There was a problem there was a variation in his potassium level. Now, however, his hospital stay prolonged. Now, even though it became normal, his stay. So naturally, when your results are abnormal, you have to stay in the hospital for long. But now the potassium level has stabilized. Why he is still in hospital? It's because of prolonged it's because of the slow learning process of Mr. Walters and Mrs. Walters regarding the condition, that's the CRF and CAPD procedures. And this is what we can see. Now we have to see what exactly his background is. Mr. Waters is schizophrenic. He's not mentally stable, and he is currently on disability support pension. This is what, because you are writing to a community support nurse, you have to write this thing. So you just don't conclude like schizophrenic. So I need to give an additional information. As you're writing to a community nurse, you have to say that he is receiving community support pension. It's important there for a community nurse specialist. It's needed. He has a history of delusions. Now we have, in the case note, we have mild chronic delusions and all. So we just generalized it. I just didn't write mild or chronic delusions. I have said delusions, that's it, generalized it. However, his mental status is stable now. If you want to add the word relatively, then you can add the word relatively there, because the word relatively is something which is significant there. Okay. His wife, the primary carer of him, also has poor intellectual potentials. Now, the ability to grasp information or knowledge is low for Mrs. Waters, who is the primary carer for Mr. Waters. He also had diabetes mellitus, which is well controlled by oral hypoglycemic drugs. Now he is diabetic, and he is that condition is managed by oral hypoglycemic drugs. Now we can say the request, what you have to do. It would be appreciated if you could educate Mr. and Mrs. Walters. I need education for the patient as well as his wife. So I have to say, educate Mr. and Mrs. Waters about the procedure, that is CAPD, including prevention of infection via catheter. So this is something relevant. It is given specifically, and any signs of peritonitis. Now we have to give information regarding CAPD and CRF. The instructions to prevent infection via catheter, and if you have any signs of peritonitis, you have to give education. What are these things? Please monitor for any signs of psychosis and seek medical attention if necessary. PRN means if necessary. If necessary, seek medical attention in case of any signs of psychosis. Kindly emphasize the importance of maintaining a low potassium diet. Now, this is the third instruction, and if necessary, if possible, if it is needed, if you think it is needed, provide the service of an Aboriginal health worker to the family. So you have to see that too. So we have the instructions expanded. So these are the instructions which are given to the nurse who is going to care this patient. So first thing, we focused on the education. Another thing, we focused on the instructions and the service which he might need. So this is all about the thing. If you have any further queries, please do not hesitate to contact me. Yours faithfully, Charge Nurse Charles Gardner Hospital. So we have come to the end of this session. Before that, we just look at this picture again. Date, address, salutation, patient name, age, the purpose. You can see the purpose, the requirement is set in the beginning, and the condition is set in the second line. Now, what is the present status of the patient when he was admitted, and what was done, and what is present thing here? Now, we can say, sorry, yeah, the background of Mr. Waters. So what is he? He's schizophrenic, and he is receiving these things, and he has his wife has problems. He has diabetes mellitus. All these things we have done, and the request we have made in the last paragraph, and we have closed the letter like this. Thank you once again, and have a nice day. Thank you.